So today I'm going to go over a quicker video, kind of a condensed version of the scheduling protocol. And this will include accelerated hygiene. So it should be maybe a precursor to the other more in-depth videos about how to schedule. Obviously, the important thing is to know kind of the rules around the scheduling mechanism and then to adhere to it just as religiously as possible so that you can increase patient flow, patient experience, and for those newer dentists or those associate dentists that are just getting started, it allows them to run a little bit of a slower schedule and then condense their time frames without people having to relearn it, okay? So I've put the rules up here at the top, okay? And we'll go over them one by one and then we'll kind of go through their examples, okay? So first rule is that all appointments should be in 1 hour increments, okay? We used to have appointments that were a little bit different than that. Some of them were 45 minutes, some of them were an hour and 15. And what ended up happening was it would just create all of these open spaces throughout the schedule, and it just never worked. So all appointments should be in half-an-hour increments. Now, there are a couple of shorter appointments, and those are scheduled to a half hour. For example, your child prophy, your secondary impressions, your crown seats, and your unspecified appointments, okay? So they're all 1/2 hour, okay? Very important to make sure that all of your staff knows that it's going to be in hour increments, okay? Now, there are providers that are just starting out that are a little bit slower. If you do need to extend appointments, they need to be extended to 2 hours. For example, if you have a longer, let's say we're doing 6 crown preps, you would need to extend that to 2 hours. The issue is if you only extend it to an hour and a half, you're going to find out that people are going to push the next appointment. They love playing kind of like the game of Tetris and putting the appointment right next to each other. And then you're going to create all of these half-hour gaps. So create it to 2 hours, okay? I'm going to add just another rule here. If you need to do a combo appointment, meaning let's say that you're doing fillings and an SRP, you're usually going to put both of those appointments and shorten them to the length that they need. So if you can do fillings and an SRP all in the same appointment and you can get it done in an hour, then you're going to put the filling, let's say it's just an occlusal or a buccal, you're going to put the filling, potentially put it for a half an hour, and then put the SRP, let's say that you're doing just one quad of a limited SRP, you're going to put that at a half an hour, okay? If you need to combo, put both appointments one after another, okay? It'll just give your staff more ability to set up for those 2 appointment types, okay? The other thing too here is, and this is kind of a change from past scheduling mechanism where we didn't have this staggering, is that OP1 and OP3 should always begin at the half an hour and OP2 starts on the hour, okay? Why do we do that? Just imagine, okay, you're a super fast doctor and you want to condense time frames and you have, 3 operatories and all 3 patients start at the same time. No matter how good you are, your third patient is probably going to start a half an hour late anyway as you get the other ones done. So it just makes patient care a lot better, and it really helps out your new associates when they're starting to build out their second and third column, that they don't have 2 appointments show up at the same time. A lot of our new associates get really stressed out when 2 patients show up, especially for larger procedures. So it's important to make that second operatory staggered, and it always starts on the hour, okay? The other thing that's very important is that we need to adhere to the operatories listed on the appointment type, okay? So an OP1 procedure, which is our heavy doctor type of procedures, will only go in OP1 or OP2, okay? Their overflow is into OP2. And OP2 procedures only go into OP2 or OP3. OP3 procedures only go into OP3, and OP3 patients only go into OP3. So as you're doing your weekly check of your fronts, and as you're checking your clinical staff as a new clinical staff as they're starting to make it, you need to be on top of that. I see a lot of times that there's OP3 patients inside of OP1. Totally not going to happen. You know that they're probably not going to show up, and then you've just wasted time. If you want your associates and your staff to be able to make money, you need to make sure that you clear off all of the potential bogus appointments, which could be OP3 patients, and make sure that you're not scheduling to have them on your production schedule. So again, super important. OP1 only goes into OP1 or OP2, okay? OP2 only goes into OP2 or OP3, and OP3 procedures or patients only go into OP3. And we also share the OP3 between the two providers. Why? Because whoever shows up on that OP3, hey, we didn't expect them really to be there, and either one of those doctors can take it, okay? Now, obviously, if the OP3 patient has a super large preference to one of the doctors, then yes, then that doctor will take that OP3 patients, okay? Hygiene appointments need to be on the appropriate doctor operatories, okay? So when doctors are pulling, or when we're overflow from hygiene and accelerated hygiene, a prophy needs to go onto OP1 or OP2, preferably on that OP1 as it's designated on the appointment type, okay? Those prophys a lot of times take up just as much time, or maybe even more time than a crown preparation. So it's important that we slide those over to the appropriate OP1 or potentially OP2, especially if you're running a hygienist with accelerated hygiene. Their operatories are going to coincide, their operatory 1 and their overflow is going to coincide exactly with the doctor's production and OP2 operatories. So okay. Another thing that we've run into is doctors getting super stressed out when there's two root canals side by side. So if you are going to put an OP1 procedure into OP2, okay, especially the larger ones like root canals, crown preps, things like that, you need to have the notation of the doctor override, meaning let's say that you're back in the clinic, the patient wants to schedule those two crowns, and we don't have any availability in OP1. Well, let's say that we don't have any availability in OP1, and let's say that there's a few root canals, and the assistant says, hey, he'd like to come in at 10 a.m., but you're doing another root canal at 9:30 a.m. Is that going to be okay? The doctor needs to look at it, see that at 2 p.m. that day there's a couple of prophys, and say, nope, let's get him in on the second operatory at 2 p.m. instead of that one at 10 a.m. So any larger procedures really need to be approved by the doctor to do an override into OP2s. That way we're not getting two root canals happening at the same time. We're not getting 6 anterior crowns started at the same time, okay? Another one, this is especially important for owner doctors. No blocks on the schedule unless approved by the provider for that op, okay? So it's important that the doctors manage their operatories, okay? Hygienist manages their operatories. And if there's any blocks on the schedule, it has to be approved by that provider for their operatories. There's no assistants, there's no fronts, there's not even really other providers that go in and put blocks on other provider schedule. That's just not acceptable. It upsets doctors. Why? Because doctors depend on their schedule to go in and make money. So one of the classics is an assistant will come in, and in 2 weeks they know that they're going to be out. So they'll put a column in there and say only 2 assistants need to find coverage. Well, the problem is now for 2 weeks we're not able to schedule patients on that operatory, and as soon as the doctor finds out, they delete the block, but there's no patient scheduled. So putting blocks on someone's schedule is very, very looked down upon, and you absolutely have to have permission from that provider to put blocks on their schedule, okay? We talked about this before. Doctors share operatory patients and the column, okay? Or doctors share OP3 patients in their column. And then another thing too is doctors need to be able to see new patient to hygiene and new patient adult with Prophy where they can up or can down convert as needed. So the rule is, and some doctors have kind of modified this, but the open and affordable rule is if you can't get a patient in by the following week, by the end of the following week, okay, so let's say this is Monday, it would be for the following Friday. If this is Friday, again, it's for the following Friday. The doctors need to be able to see that new patient adult with Prophy. Now, some doctors will up convert that, meaning they'll do the comp oral, they'll do the cleaning. It's a slow schedule, and then they will potentially do some fillings. But some doctors are so busy that they're going to down convert that to, let's take the pano, see if there's anything going. We'll take care of a couple of the larger concerns, and then we'll get you back to a new patient to hygiene later on with the hygienist or possibly with the doctor or with the associate doctor at a later date, okay? But the big thing is, and this is so important, that some doctors have created a more aggressive protocol in their offices where every single new patient that calls needs to be seen by the following day or the doctors will see them. So again, it's super important to be able to get patients in when they want to be seen. Again, we take walk-ins, so it's kind of a foreign concept to a lot of the owner doctors that people would be getting scheduled out a couple of weeks when they want to come in today. So super important, okay? As far as the accelerated hygiene operatory 1 is corresponding to the doctor's operatory 1, so it starts on the half an hour. Hygiene operatory 2 starts on the hour. So again, very similar to the doctor's OP1 and OP2, okay? The other thing too is because the hygienist is kind of skipping back and forth between patients, the hygienist will write their concerns on the routing sheet. Okay, for example, I saw something on 12, please look at it. And the hygienist assistant, because the hygienist is in the other operatory, the hygienist assistant will come and get the doctor and say, hey, hygienist is ready for a comp oral in their OP1 or OP2. And they had concerns on 12, 13, 14, okay? And then the assistant, essentially, what is the assistant duty? The assistant will take the x-rays, break down, set up the room. The assistant will do the perio charting. The assistant will also chart for the doctor, and the assistant will also kind of check in and check out the patients, and then the assistant will also communicate to the doctor any concerns from the hygienist. So really the hygienist's role is to diagnose perio, treat perio, and that's about it. So a lot of our hygienists have actually started liking accelerated hygiene as long as patient care does not suffer. Patients feel like they're getting an adequate to thorough cleaning, and the patient relationship isn't getting sacrificed. So let's just take a look at how some of these rules have been implemented in our schedule here, okay? So this becomes kind of the normal two-doctor, and you can pretend if this was just one doctor, it would just be OPS 1, 2, and 3. And here's a sample accelerated hygiene schedule, okay? So let's go through some of these appointments and just let's kind of talk about them, okay? So you're going to see again for our first rule, all appointments are set to 1 hour. All shortened appointments are set to a half an hour. So here is a child Prophy, here's a crown seat. They're all set to a half an hour, okay? You're going to see here OP3 patients are only scheduled in OP3. There's no OP3 patients outside of Operatory 3, okay? So the other thing too here is you're going to see here that there's occasional appointments that are extended, okay? Even with the owner doctor here, they have an anterior 6 and they have extended this crown preparation to 2 hours. Now you'll see they did not extend it to an hour and a half. Why? Because they have all of these other obligations, and so they don't want to start messing up their staff by doing something like this, because the tendency of the staff is to get something here, and then you're going to get into the same situation where 2 patients show up at the same time versus a better patient flow going this way. Okay, so if you take a look here, here's that anterior 6 for 2 hours, and then here is our normal OP1 appointment fillings set for an hour, set for an hour, set for an hour, okay? Set for an hour, set for an hour, set for an hour. You'll see every single one of these are OP1 type appointments. You'll see that designated right here in the appointment type, okay? So when we come over here, you can see Operatory 2 starts at the half an hour, okay? And every single appointment, except for these shortened appointments, which are automatically set to a half an hour, are the hour-long appointments, okay? So here's an OP2. Now, you'll see here that this is an Operatory 1 type appointment. Well, what did we do? We put that we're okay to override. It's been approved by the doctor that we can go ahead and start these fillings even though we're doing that. Super important, because newer doctors are super uncomfortable running 2 columns of Operatory 1 type appointments, okay? So again, here's an override. Now, do we need an override for this denture? No, we don't. This is a normal OP2 appointment type, okay? And then you'll see these half an hour OP2 appointments. This is a child Prophy. This is the crown seat. Now you'll see that this crown seat has been extended to an hour. Why? Because we're seating 6 anterior crowns. So this is a situation where we've extended that amount of time, okay? A normal OP2 appointment, a normal OP2 appointment, okay? We have another normal OP2 appointment here, half an hour, and then instead of putting this up at 5:30, what are we going to do? We're going to put that in right at the hour. Why? Because we essentially could fit another OP2 shorter appointment right here in this spot, and we could potentially set another one right down there, okay? So then if we take a look at OP3, again, it's a shared OP between doctors 1 and 2, okay? Here's a normal OP3 type of appointment, a whitening, okay? That's going to be run 99% by the assistant, okay? Here is another OP3 appointment just to look at pathology. Now, some of these are actually overflow where we didn't have space in our OP2, but again, OP2 appointments can go into OP3, not a problem at all, okay? Now, usually a lot of these crown seats would actually have a designation on a patient alert to say, hey, this is actually a crown seat of Doc 1, okay? Here's an OP2 appointment that was just overflowed to OP3. We didn't have any time at that point, okay? Here's an OP3 patient, needs to go into OP3. OP3 patient needs to go into OP3. And then again, here's some of these OP2 type appointments that have been put into OP3. Why? Because we don't have any availability on Dr. OP2 or Dr. OP1 for those appointments. So we just put them into OP3, not a problem, okay? So when you're looking here at the Dr. 2 production, you'll see this must be a newer doctor. They're extending their appointment times to the 2 hours, okay? And just to make sure that they have time to not get behind, okay? So you'll see all of these appointment times. They start at the right time. You're seeing that they're starting at the half an hour, starting at the half an hour, starting at the half an hour, so that when this doctor becomes quicker, and let's say that all of their crown preps start being an hour, hey, no one is changing their protocol. We're simply just saying, hey, we're now going to be doing those at a half an hour, and we're starting to open up some of those, okay? Now, you can do the same even with the OP2 appointments, okay? So here's some emergencies. They've been extended for 2 hours. Why? Because we don't want this doctor to fall behind, okay? Again, there's an override. Here's a half an hour appointment that's been extended to an hour. We could essentially extend this to an hour, But again, you can see they're all starting on the right time. Now, there are situations here where the doctor may want to put a block next to their root canal. A lot of times if they're doing their first root canal, they don't want to be doing hygiene checks. They don't want to be doing extra procedures, okay? But this needs to be set and approved by the doctor. This should not be put in by assistants, or the doctor really shouldn't even be saying, hey, for right now, if you schedule a root canal, no. The doctor needs to go in there and do this because, as soon as they're ready to reduce this to an hour, then there's no change in protocol, okay? So again, this is super easy to transition from this Doc 1 schedule. As soon as they're up to speed in a few months, they'll be running a similar schedule exactly like the first doctor, and no staff will need to be retrained, okay? So let's move on to hygiene, okay? Now you can see here, the nice thing about hygiene is Operatory 1 is a lot of their bigger procedures, these new patients, SRPs, whatnot. They can have some of these over here on OP2, some of these bigger procedures, but usually, if you're having an SRP or a new patient on this OP2, you want to check in with a hygienist to make sure that that's okay. Usually it's going to be okay. And then again, the hygienist might have some issues with running 2 operatories. Maybe they can't do an SRP at the same time, or maybe this is a very tough SRP. So they might put in these little blocks to block off their schedule, okay? So that they have time to complete that SRP. The nice thing about running these same columns is you can see here was an OP1 procedure in OP2, but we can slide it right over here. And guess what? We free up the doctor, and it's just seamless. So again, it's nice to have both the operatory 2 for the doctor and the accelerated hygienist OP2 starting at the same time, so we can just slide in as patients cancel, okay? So again, there's the OP1, and then again, here's your hygienist OP2 type procedures, okay? There's that Prophy child, okay? There's that new patient Prophy child. There's a recall. There's a recall. These types of appointments usually are going to find their way to the simpler side, which is OP2. The heavier procedures, these new patients and the SRPs are usually going to be on the hygienist OP1. So in a nutshell, as long as you're following these rules, it's going to be very easy to implement this at the office. Everyone's front clinic, doctor, hygienist will know where appointments should be. There will be a rhyme and reason for why we're putting things where we're putting them. Patient flow will be increased. Patient experience will be increased because you're not going to have everyone showing up at once. And then you're also going to have a more organized and structured way to handle every single type of appointment. So watch this video over and over until you can come up with all of these ideas in your head without having to look at the rules. And there really aren't that many rules. And you'll find that your patient experience increases, your patient flow increases, your doctor stress goes down, your hygienist stress goes down, your staff stress goes down, and especially for people who like to show up and see something that's organized, this scheduling mechanism has really helped them. So thanks so much for watching.